All set, Michael.
Great. So I want to welcome everybody this evening to Recovery Connection Centers of America. This is our town council meeting, which we thought would be a good idea to have an opportunity to assuage some of people's concerns that are out there in the town that are not familiar with the types of services that we might provide, and try to address any of the questions that are out there about what our business actually does, how our practice actually works. My name is Michael Brier. I am the CMO of Recovery Connection Centers of America. I'm joined here by Greg Graustein, who's our Chief Clinical Director, who will have an opportunity to speak to you in a little while. Susan and Christine are our attorneys who have been kind enough to put this together for us, along with the town of Dedham, and we want to thank the town very much for this opportunity, because this is a little bit more, it's an easier way to address these concerns as opposed to going in front of a zoning board committee and everybody having lots of questions and things, and it just gets out of hand. And we just want to be able to talk to you guys and hopefully answer any questions that you might have out there. So, excuse me one second. I apologize. All right, so who we are. We are a privately owned medical practice that provides addiction medicine and counseling services to individuals seeking assistance with their recovery. We only focus on one area of practice, which is opioid dependency, okay? We have been in business since 2016. We started in Rhode Island, in Providence, and currently we have offices open in Taunton, Attleboro, Brockton, and we are opening, or in the process of opening, a number of others in other towns. So our mission is to provide the highest quality medical behavioral health treatment to those afflicted by substance abuse dependency within the various communities which we treat. We assist our clients suffering from this terrible affliction through the latest advances in medication for addiction treatment as a complementary, innovative practice to be utilized alongside proven therapeutic modalities. So we have designed our offices to provide patients comprehensive pharmacological and behavioral interventions. We assist clients to abstain from illicit substances, improve their mental health, physical well-being, and reintegrate themselves as productive members in our community. So we believe that anyone can achieve and sustain long-term sobriety in recovery. Many people are unfairly stigmatized as homeless, drug dealing, and criminal. And some of the concerns, we've heard these many times before. However, with our substance use disorder program, we want you to know that achieving long-term sobriety and recovery and growing into a leader within the community is attainable for all of our clients. And really the reason that our clients come to us is because we are not what some of you might think an addiction treatment practice is all about. So let me just talk to you a little bit about services that we provide. So we provide only 2 medications, and really they're actually the exact same medication. They are buprenorphine-naloxone. That is a combination of 2 different medications. Buprenorphine is the one that actually attaches to the frontal cortex of the brain to stop the cravings for any type of opioid dependency. The naloxone is similar to what you all are commonly known as Narcan. And Suboxone is actually either given in Suboxone, first of all, is a brand name. It's like Kleenex. It's not actually the medication that we give, but it's actually just a commonly known brand name that's out there in the marketplace. Suboxone is usually taken either through a tablet or a film that is put into the crest of your mouth. It's dissolved there and it goes into your blood system. Sublocade is actually a shot which is administered into your stomach area, and it's usually administered once a month by a clinician, okay? Some of the other services that we provide are tobacco cessation, substance use counseling. We offer community referrals and external supports to all of our clients, and we offer them self-help counseling, okay? All of our clients are given toxicology or screenings of their urine to validate their compliance in the program. Obviously, if they're not going to be in compliance, we're not looking to necessarily to prescribe medication to them if they're not going to make a committed effort to be compliant with our rules and regulations and policies that we have in place for the practice. So these are the current offices that we have open right now that are already seeing some of our clients: Providence, Attleboro, Taunton, and Brockton. Okay. Excuse me, let me just go back here. So let me just, this is an interactive PDF, so excuse me if I'm being tricked a little bit about it, but it worked well when I did it by myself. But now that I have it in front of people, that's when I make the boo-boos. Anyways, let me just go into our office operation. So our offices are staffed with one full-time office manager. So there's one person in our office 40 hours a week who is doing, for the most part, a lot of administrative work. When the office is actually seeing any of our clients, it's staffed by a licensed medical provider and a credentialed counselor. So there's two other providers in the office when we're seeing patients. But our hours of operation are typically twice a week for about 3 to 4 hours each day. And as the practice grows, we will be open additional weeks, usually some type of a Tuesday, Wednesday, Saturday, and a lot of it is predicated about the availability of our providers to be available to be able to see our clients in those suitable time frames. So it's not always a known thing before we open our offices what exact days we will be open. But we try to accommodate our clients in the afternoons or later or early evening times, sometimes on Saturday morning. Why? Because a lot of our clients are actually working people who have jobs from 7 to 3 and are only able to come into our offices after that time. So there is no point in us being open to require them to come in, because part of our whole policy and procedures, because we want them to be reacclimated back into the workforce. We want them to have their jobs. We want them to maintain paying their taking care of their finances, taking care of their family, and doing all the things that most of us are accustomed to, okay? All of our appointments are scheduled. We do not allow people to just walk in off the street to be seen by the provider. We try to schedule our appointments at 15-minute increments, so usually there's no more than 4 clients in our office at any one time. Typically, you'll have one seeing a doctor, one sitting in with a counselor, and 2 more people in the waiting area doing all the paperwork that they need to do before they can go in to see the doctor. Our office is no different than any other primary care doctor or psychiatric behavioral health office. I can't emphasize that enough. You will not notice any difference in the way we operate than any other medical office that you have ever been into in your life. You walk in, you get greeted by the person at the reception desk, you'll be given some paperwork to fill out, you'll sign the paperwork, you'll give it back. The receptionist will say the doctor is ready to see you. You'll come in, you'll see the doctor. The doctor will prescribe you medication. You will not be given any medication to walk out the door with when you leave our offices. Rather, there will be an electronic script sent to the pharmacy, CVS, Walgreens, whatever pharmacy they want to have it, it will be sent there and they will go to that place to collect their medication. Okay. Now, on occasion, we do administer the injection of Sublocade. However, that is given to us from usually one of these specialty pharmacies. And as somebody who actually gets other types of medication from the specialty pharmacy, you'll know how they operate, which is you tell them which day you need the medication, and FedEx drops a package off at your house or drops it off at our office to be given for that day. The medication is good for that day when the patient is going to come in. So we try not to ever maintain any medication sitting on our locked refrigerators overnight. The idea is it comes in, it leaves inside of somebody's body. It is not taken out of our office. So this is just a general overview of our offices that we have. Now, there was a petition that was posted up on a website. I don't even remember the name of the website. And there were some issues, some concerns that were voiced by some of the people out there about us opening at 259 Washington Street. So this is an example. This is our Providence office. We've been open up for 5 years now here. We're located right in the Fox Point neighborhood. If you know Providence at all, Brown University is less than a mile away. There are a number of schools right around that area. This is a map of the area, so you can see there's a mall about a mile away. There's numerous restaurants and liquor stores on the street. There are schools in the area. We have never, ever had any issues with the city, with the neighborhood, with anybody around. In fact, if you were to go and poll the neighbors in the area at each of our offices, I think they would have a hard time to even know what the heck we do and who the heck is inside of each of our buildings. This is a letter from our landlord in Providence attesting to the fact that we've been good citizens and that we've never had any issues with the property there. This is our Attleboro office. As you can see from this screenshot here of the office, we're located on the second floor of this building. So the first floor is retail. The second floor are offices. The third floor is residential. There are people living on the third floor. There are people living on the fourth floor. I didn't even mention that in the Providence office, that's actually a 3-family house that actually has tenants living on the top floors there. So residential is right there in our area, and even the people who live in the building, for the most part, have no idea what it is that we do. This is the area around that particular office. You can see again the number of liquor stores, schools, and shopping right there within that office space. This is our Taunton office. This red space, this red building right here, this must have been a picture that was taken prior to us putting signage up, because there is a sign there on the building now. But as you can see on the street, this is all residential here across the street. This is a main road. So this is 138, similar to Washington Street, where we're going to be located in Dedham. Again, just showing you, excuse me. Again, this is liquor stores and bars, the malls that are around there, also educational institutions and schools that are around that particular, oh, I'm sorry, this is the wrong one. It's this one. There we go, I'm sorry. Same thing, liquor stores, shopping, and schools within a half-mile radius of that particular location. And lastly, this is Brockton. Brockton we just opened recently, so that's why we don't have as much information, but this is located literally in the Westgate Mall area. So if you're familiar with the Westgate Mall is a massive commercial area. We are located right next to a church, which is this space. If you can see my mouse right here, where the red car is actually where our office is located. And there's physical therapy and accountant and some other businesses right around that area. Across the street, right here on the other side that you can't see on this picture, is actually Market Basket, Staples, Chipotle, Starbucks, a Bank of America, Verizon store. You get the drift. There is a number of different other retail locations right there across the street. Not one of them has ever come to us with any concerns about our operations. We have been good tenants in the area, and we will continue to be that way. This is where we're going to a proposed location for the Dedham office. Just want you to notate that right here where the red car is coming out, this is the exit from the Dedham Mall. This is where, if you go down there, behind our building, obviously, is the H&R Block, and down that road is where I think it's the Bob's Furniture Store parking area is right down there. To the left of us is Vargas Dental Services. The medical office there, she is only open on, according to her signage, Mondays and Thursdays for 3 hours on those particular days. There are various other medical practices on this particular street and a number of other retail locations. This is obviously, I don't want to preach to you. I live in Newton. It's not like I don't know Dedham, but I don't live in Dedham. But I know this is a very, very busy street, as you know, that you can't even make the U-turn on this street because of how heavily trafficked it is. There are some houses across the street from here, and I believe there's a restaurant across the street, and then there's the Midway restaurant, a couple of houses, 3 houses down to the left of where our proposed location is. There is plenty of parking at this particular location, both on the upper and the lower side, so that we shouldn't have any problem with traffic. The access to this location is excellent in terms of potential people who need to get our services, and that was one of the predicated reasons of why we chose this location. It's in a commercial area, it's got ample parking, it's kind of isolated since it only has a neighbor on the one side and nobody really on the other side. So Dedham community is situated in Norfolk County. I don't need to tell you that, but here's some statistics I'm not sure that everybody is aware of, and I just want to bring it to everybody's attention, which is 2018, Mass Department of Health reported that Dedham had 51 overdoses, of which Norfolk County in the same year reported 172 overdose deaths. Dedham was responsible for about 10% of those overdose-related deaths in Norfolk County alone. 2019, the numbers increased to 63%, an increase of almost 25% from the prior year. The current year data, which is only the first 2 quarters of this year, has already seen Dedham with 31 overdoses, which is another 12.9% higher compared to 2019. I have looked in the police records that come out weekly or every 2 weeks, and I don't see any reason that our assumptions that the overdose numbers are going to be higher than the prior year are incorrect. This, excuse me 1 second, hold on. Nope. Yeah. There we go. Sorry, learning mouse things. This is the statistics of overdose deaths in Norfolk County for the past 9 years, not including this year. As you can see, obviously, there's been a dramatic increase from 2010, 58, 2019, 132 deaths in the county. So some of the concerns that were voiced on the petition were within 1 mile of schools. This is a map that we have done of the particular area that we have. There is a school or a couple schools, it looks like, nearby, similar to every one of our other offices that I've already demonstrated to you. The same thing for liquor stores, and obviously all of you are familiar with the mall that is right next door to us. All right. So in February 2021, Dedham, Mass has no certified opioid treatment recovery programs recognized by the U.S. Department of Health and Human Services, or SAMHSA. SAMHSA has only authorized 5 providers within a 10-mile radius of our proposed location to prescribe Suboxone. In addition, even though those authorized providers are listed as Dedham, that just means that's where they listed their address when they signed up with the actual government. That does not mean that they're actually practicing in Dedham. We have not been able to find one provider practicing in the Dedham area currently. Another concern was the bus line on Washington Street, which could take you all the way downtown to the methadone treatment in South Boston. So, town of Dedham, you're at a major junction to the greater Boston area. We chose the location because of the need in the community. The Dedham Department of Public Health has a partnership with the Dedham Organization for Substance Awareness, which operates in conjunction with the Dedham Police, Fire, and Public School Department. And obviously, we'd like to have a strategic partnership with the DDOSA in the near future. We've spoken with them, and obviously, they must have recognized that there was some need for them to enter into the public school system. And I assume that that's why Dedham Department of Public Health created this particular organization. Now, residential housing, all of our current offices are located actually in buildings with residential housing in them or are across the street from them. So again, our office is no different than a dental or psychiatric office or your PCP. You will not notice any difference, our operations versus any other medical office that's operating. People will come, people will go, and that's it. There's nobody lingering around our offices. Additionally, our clients do not come on a daily basis. Our clients will come either weekly, bi-weekly, every 3 weeks, or monthly. That's it. There's no reason that any of them need to come more often than that, but I will let Greg address some of those issues. Liquor stores, so this is kind of important. For some reason, people think that alcohol use and opioid dependency are co-occurring substance use disorders, and the opposite is true. The two don't go together. In fact, probably 5% of all of our particular clients actually have any type of alcoholic or recognize themselves as alcoholic in nature. It's usually one or the other. So Recovery Connection Centers of America is not a methadone clinic, okay? We're not even a clinic at all. We are a physician-owned practice. Again, I'll say that again. We're not a clinic. We're a physician-owned practice. We are owned by our physicians. Greg and I work for the company as part of the management staff. We're not the owners of the particular practice. The doctors own the practice. They are the ones who make all the medical decisions. Our practice allows our patients to receive addiction medicine treatment, medication-assisted recovery, and supportive counsel and collaborative approach to meet the individual needs of our patients. Our patients, again, start either once weekly, bi-weekly, twice weekly, or monthly as they continue to progress and develop the social support. Okay, our commitment is that we value, should have turned off my phone, I apologize. Recovery Connection values both its clients, staff, landlords, and neighbors. We were founded on the principle of doing good deeds and helping all of our communities in order to make them a better place to live. We're responsive to everyone and are always open to listening to ideas to make our company a responsible partner. And I will say this now, since we're recording this, and I would say it to anybody in the community, if there's ever an issue, if there's ever a concern, if there's anything that ever comes up, I would be more than happy to address those issues. All of our staff would be happy to answer any questions that you might have. We want to be responsible partners in the area. We do not want to come in here and not work with you. Our whole idea is if we work with you, we make the entire town of Dedham a better place to live. If you want to learn more about Suboxone treatment, we have a number of podcasts. You can go Apple Podcasts and you can go pull them up under Recovery Connection. And please feel free to listen to them, and it will tell you everything that I've just discussed with you this evening. It's going to say exactly the same type of information. So let me just do this. Let me, Greg, I think I can unmute you. Or unmute yourself, you're good. So
I'm good. All right, so that was my intro, Mike?
Yeah.
Unmute you? Okay.
So as our chief clinical director.
There we go. Thanks for the intro. So Greg Graustein, Chief Clinical Officer for Recovery Connections. So I have over 30 years of experience of working in the population of opiate dependency and treatment with addiction. I want to just briefly go over a couple things that Mike had gone over, what the patient experience is, but on a different level. When they come in, they've made an appointment, either they've come from their primary care, we're getting referral from a hospital or urgent care, or even the police department may actually contact us. That's where I'm connecting myself also to the police department to also make sure that they understand what we can do. Patient comes in, sees the manager, gives a urine, sees the doctor for the medication, and the most important part also to sit with the counselor to discuss recovery of themselves, recovery of their lives. Because of the product of Suboxone, or truly the buprenorphine, is now the gold standard of treatment of opiate dependency. That's what we prescribe. It works so well, it prevents craving, it also can block opiates, and then while that's going on, that person is feeling stable to be able to work on the issues that they have created in their life and recover them. That's what recovery is. So that's their experience to come through quickly. They're not staying on our property or milling about in our area, because we have already proven to our other offices, as those photos of our offices are daylight during our operations already. We do not have lines of people outside. How am I integrated into the communities? I connect with the boards, the drug task force in Brockton, in Springfield. We haven't even gone into Springfield, but I'm already connecting to it. The police department of Dedham has an opiate task force, and I'm connecting to the police chief to talk with him to make sure he knows who we are and how we can be a responsible support for his community. This is who we are. This is what we're attempting to do, is to provide a small facility, not a Walmart, not a large addiction facility. We are not going to grow into a monster. We recognize the ability to provide treatment for this population in a professional form to impact this community greatly with an amazing medication and an amazing treatment philosophy. So that's who we are. And we'll be open to questions if you want to put them in the chat line as well.
Yes, please. Instead of opening this up to everybody, just because it's difficult on Zoom to do, if there are any questions, if there's anything that we haven't addressed, if you could please just type in your question in the Q&A so that we could answer those. We would like to assuage any of the concerns that you might have about our operations and how we physically are constructed or how we operate. I'm going to ask Aiden, since he's the only one I actually know of the people who are on the list, if he has any questions. All right.
And Michael, if I may, just for the record, we are not within the immediate area of any schools. We meet the zoning ordinance requirement that we're not within 1,000 feet of a school. Just to clarify for that, for the record.
Okay. Does anybody else have any other questions that we didn't address? I mean, I understand that this type of practice has a stigma attached to it. There's various organizations that are out there to combat that idea out there, to actually to educate people about what it is that we do. You can go, and if you feel like it, we'd be more than happy to give you, resources to people to talk to ask whether everything that we're saying is valid and true. There's nothing, we're an open book, as they say, and we'd be more than happy with whatever questions you might have to address them. And if you don't have them this evening and you have them some other time, I will tell you that my email address is michael@drughelp.info, not .com, .info. So drughelp.info. And Michael spelled A-E, not E-A. You can address them to me. I will either respond to you or I will have somebody on the staff respond to you, depending on what type of a question it might be. And we'd be more than happy to answer those questions that you might have. And unless somebody else has any other questions.
Thank you, Aiden, for recognizing my commitment to Massachusetts. I was born in Lexington, and of course, a big sports fan. So thanks for your comment on the sports memorabilia.
Christine, you're actually muted if you're trying to say something.
Thank you, Michael. We do have a hand raised by a Stephen. I will go ahead and allow him to ask the question.
Okay.
Stephen, you should be able to talk now.
I guess on mute.
Okay.
I represent your neighbor, the dentist.
Okay.
I would like to, I'm inquiring, what have you done with both the Dedham Police Department and the Dedham Board of Health with respect to these issues? Because you did reference that you had interacted with or come into accord with them. I would like to know specifically what you have done.
For myself, my outreach to the Dedham Police Department has been for a collaboration of them to know who we are and sending them our brochure to their opiate task force that they have. I have not had communication with the Dedham's Department of Health. That has not been a question.
I'm sorry.
That has not been a concern.
So you have sent them information, but you have received nothing back.
I've sent them information to ask to be on their next opiate task force that they have.
Okay.
As I've been on the Brockton task force, the Springfield task force, as we go into territories that have task force, we inquire as well as ask to go onto their boards so we can on a monthly attend and to know what's going on in the community for other recovery facilities or practices or hospitals and what they're doing for discharges and how they're impacting their community.
Okay, sir, I respect that, but I'm not interested in Brockton. I'm interested in Dedham. And
Correct.
what about the Dedham Board of Health?
I haven't been attached to we're not attached to the Board of Health.
So if I may, Stephen, is that your name? Is that correct?
That's me.
Sorry, Stephen, my name's Christine DiBiase, and I'm one of the attorneys representing RCCA. If I may, there isn't a requirement here for us to have direct contact with Dedham's Department of Health at this time. At this moment, we're as you know, we're going before the zoning board.
Okay, I'm not asking that there is a requirement. I'm just responding to what I perceived as the representation that there was a reaching out to the Board of Health.
So I believe the substance abuse organization, I apologize, I don't remember the exact acronym for that organization, is a part of the Department of Health. At least Miss Knight, I believe is her name. I forget her first name. Perhaps it's Christina Knight. We've reached out to her a couple of times just to let her know that we were, one, interested in Dedham, two, to try to learn from her about what she perceives in the town, of what the town's needs might be in terms of fighting this rampant overdose that is going on in the town. When we go into towns, there's nothing back and forth. It's really us saying, hey, we're here. If you need us, we're a resource for you. And if we need you, we'd like to be able to refer people to you as a resource also.
Okay, sir, I'm not trying to cut you off, but my question was much more specific than your generalized answer. It had to do totally with the Dedham Board of Health.
I believe Michael just said that he believes that that committee is part of the Board of Health. If that's not, and he did reach out to them and have contact. If that's not if that's not your understanding that that committee is not part of the board, please let us know. But
okay, does the gentleman have a contact at the Board of Health? The Dedham Board of Health.
Well, he just, I believe, Michael, you said Miss Knight is who you spoke to, who would be a committee member as a part of the Board of Health.
Yes.
The Dedham Board of Health?
Yes.
It is our understanding at this time that Miss Knight, who sits on the committee that Michael just referred to, is part of the Department of Health in Dedham.
There is no Department of Health. It's the Board of Health.
Sorry, that was my mistake. The Board of Health.
Okay.
Okay. Is there any? Do you have any other specific questions at this time, Stephen? Other than I think we've answered that.
No, I can reserve to the meeting. That's fine.
I mean, honestly, I would rather, if you have concerns, I would rather we voice them now as opposed to belaboring the meeting next week about these same concerns. If we can address them now and we can assuage you, then I think that would be more productive, wouldn't it?
And we're also.
Excuse me, can you ask your attorney just to stop for 1 second so I can answer your question? Or I'm sorry, or does the attorney need to answer your question?
I was asking you, sir.
I know, but your attorney was trying to answer the question.
You may proceed.
Mike,
I don't have to
freeze
give
up?
you any. I'm not giving any permission here. You can go ahead to answer that question, Stephen.
Okay, I understand what you're saying, but I don't need to play all my cards right now. You know, we have a hearing. It's a public hearing. You know we oppose what you're trying to do. It's an abutter who has a family dental practice, and they don't necessarily desire to have Suboxone signboards on the sidewalk, inviting people to come in to have addiction treatment. We respect the fact that addiction is a serious concern, but we just don't think that this is the right location for it.
Okay. I'll just make mention, Stephen, that according to the signage of your client, it's not a family practice, but rather a surgical dental practice that's only open 2 days a week for 3 hours each of those days, according to the picture I have right in front of me on my phone. But thank you very much, Stephen. I appreciate
But does that matter?
So I think we've all voiced our concerns here at this time.
Counsel, can you let your client at least engage in a little
I
conversation?
just don't think this is. I think there are other people that have some questions in the chat box, and I just don't. We're only on a limited time here. This is
Okay,
obviously
counsel. So the answer is no. You will not let your client answer.
I believe he just answered, and we're getting into
No,
the
he
subject
didn't.
of.
He didn't.
Okay. All right. Okay. Thank you for your time, Stephen.
Okay. Good night.
Okay. All right. So we have.
Let me just answer Aiden's question about the Sublocade.
Yes.
So, yeah, the Sublocade, Aiden, does get delivered to our offices the day a patient is, a client's actually coming in, and it's administered at usually on the same day, or if not, usually within 24 hours. It has a very short lifespan anyways, so it's a medication that actually has to be used quickly, or it would have to be disposed of. So I hope I answered your question. And by the way,
we follow all the controlled substance guidelines to be able to provide those medications and any other kind of medications. But that is the only medication on site, but the only short, very prime, and the rest of the medications are picked up at the pharmacy. So for any kind of concern about medications.
Excellent.
I think we're all set then.
Good question.
Any other questions for those attendees that are on? Give it another chance here. Okay, doesn't look like it, Michael.
Well, I want to thank everybody who did attend. I want to thank even Stephen for attending. I do appreciate that. And as I said, if there are any questions in the interim, please feel free to send me an email, or you can give us a call. Our phone number is 877-557-3155. You can ask for either Michael or Greg, and either one of us would be more than happy to answer whatever questions you might have. And I want to thank you all for coming, and we look forward to working with you.